Hello everyone. Today in our series of Docplexus KOL interviews, we have with us Dr. R.M. Meyyappan. He is the professor and head of the department at Department of Urology and Renal Transplantation at SRM Medical College Hospital and Research Center. He is also the past president of Urology Society of India. He has expertise in various subspecialties like Urogynecology, renal transplant, female urology and endourology. He has published numerous publications in national and international journals and has also authored books on common urological problems. Thank you so much, Dr. Meyyapan, for joining us.
Thank you.
So the first question I would like to ask you is, what strategies should be implemented in the management of chronic kidney disease?
The strategies depending upon the clinical symptoms or the symptoms of the patient and how they behave and what is their change in their routine lifestyle and other parameters you have to take into account.
So what criteria do you consider to recommend immediate dialysis treatment to the patients with CKD?
Yeah, now suppose if you do a blood investigation, the serum creatinine level is gone high, or if the patient has clinical symptoms like breathlessness, puffiness of face, or edema of feet, all those things will push the patient to go for a dialysis.
So how does a condition like kidney transplantation complicate the chances of pregnancy, and what effective approaches should be implemented in such scenario?
Suppose in case if the patient is a known case of kidney failure who has conceived, it is better to go for a medical termination of the pregnancy and followed up with the transplant, the management of the kidney disease. Then there is every chance that she can conceive again and she can give birth to a child.
Okay, but immediate termination
is recommended. Okay. Usually, it is better. It is better.
Okay. And what are the most important challenges encountered by urologists in choosing dialysis therapy or renal transplantation for their patients?
Yeah. See, in our Indian scenario, the patient cannot afford for dialysis for lifelong, and there are complications due to the dialysis also. Once a patient has got a relative or unrelative donor, live donor, and it can cost, the cost effective will be there, and it can reduce the agony of the patient also, and it will give a permanent relief from the misery of going for dialysis lifelong.
So what are your views on post-operative care after renal transplantation?
Even if the patient undergoes a renal transplantation, he has to be on immunosuppressive drugs, periodical or regular checkups with the concerned physician, nephrologist or the urologist, and he has to adopt the lifestyle which will accommodate his routine life or other activities.
So do you think an online platform like Docplexus can help raise awareness among urologists?
Definitely, because it gives a lot of information not only regarding the symptoms and signs of the patient's trouble or the availability of dialysis, what are the various methods being followed, and what are the advantages of the transplantation, everything. It gives a...
Thank you so much, Dr. Meyyappan, for joining us, and we are honored to have you on the platform.
Thank you.
To stay updated on our latest scale videos and interviews, please follow us on Twitter, like us on our Facebook page, and subscribe to our YouTube channel. Happy Docplexing!